Hello everybody. In this webcast we are going to talk about Xanthogranulomas and Mimickers. Juvenile Xanthogranuloma is a well-known benign subtype of non-Langerhans cell histiocytosis. It's usually common to appear in the early childhood, and most of the cases may show spontaneous involution. It usually has a cephalic distribution, being lesions more common on the head, neck, and upper trunk. Clinically, it might present as asymptomatic, solitary, or multiple dome-shaped papules or nodules that may vary in color from red to yellow-brown. Generally, the lesions have less than 2 centimeters in diameter. Here we can see a case on the arm of a young child. We can see this dome-shaped papule with this reddish to orange color. Colors are also important for dermoscopy. We can see that most of the lesions, they present an orange to yellow background. Here we can see on that lesion this orange background, and closer we can see also that yellow is also present. Other structures like vascular structures may also be present. Here we can see that subtle peripheral erythematous border and linear branched vessels might also be features arising in Xanthogranulomas. The connection of orange to yellow background, subtle peripheral erythematous border, and linear branched vessels make the so-called setting sun sign that might be quite specific for this disease. Orange to yellow background represents an infiltrate of large macrophages with increased lipid content, while the erythematous border and the vascular structures might be suggestive of ongoing inflammation. Here we can see another lesion with an yellowish background, and also the branch in telangiectasias and an erythematous border. Of course, that other dermoscopic aspects might be present. In this recent report, 35 pediatric cases were reviewed. Color was indeed important. 75% of the lesions had a yellow to orange color, but also pink to red and white were present. 57% of the cases had vascular structures, being most of them distributed focally, and linear vessels was the most common on that lesions. The setting sun pattern was present in 8 of 35 cases, meaning that it might be specific, but the whole sign is not present in much of the cases. Other structures like rosettes, shiny white streaks, or negative network were also described. And what about the mimickers? Of course that we can have some lesions that might be confusing and sometimes difficult to differentiate from juvenile Xanthogranulomas. We can see, for example, this Spitz nevus that clinically is not so different from that Xanthogranuloma that we showed on the arm. It has this reddish dome-shaped papule, but on dermoscopy we can see that the background is brownish, and also the vessels are more dotted than this branch in telangiectasias. Media cyst-like may also dermoscopically appear similar to Xanthogranulomas. It also has this yellowish bright color, and we can also see branching vessels on the periphery with this erythematous border. Sebaceous hyperplasias also present this dome-shaped like appearance. Dermoscopy, it also has yellow color or whitish color, but of course the viscous are slightly different. Most of them are in a crown distribution around the lesion. Xanthomas also present yellowish color. Here we can see a case, and here another case showing this orange to yellow background. It's well known that non-infectious granulomatous diseases may also present orange to yellow background. In this case, we can see sarcoidosis showing on dermoscopy this orange background with an erythematous border and also linear viscous on the periphery. Of course, that clinically it might be quite different, so it's also important to always put together clinical and dermoscopic aspects to establish the differential diagnosis. Another case with a yellowish background on the center, arborizing telangiectasias, erythema on the border, and here we have a case of nephrocobiosis lipoidica. So finally, we have our take-home messages. We always might take in count yellow-orange color to diagnosis of juvenile Xanthogranuloma. It has usually vascular structures. The connection between them make the so-called sun-setting pattern, which might be quite specific for the disease. We always need to take in count clinical and dermoscopic aspects to perform the diagnosis, and never forget to biopsy every time we have equivocal or atypical lesions. Thank you very much for your attention.